Everything that we do and discuss at the assessment is put in a full written report. I can't always assume, particularly if the individual is on their own, that they've heard absolutely everything that I'm talking about. So we like everything to be in black and white. And in that report they get a full list of all the results and the choices that are open to them. So there is lots of different technologies. We are an independent practice, and I will make recommendations based on the hearing loss, and we will list the different levels of technology. With each different level comes a different cost, and then it is dependent on the client as to what decision they reach is based on the budget and the listening environments that they need to hear better in.